Good morning. I wanted to follow up to a couple of questions I'd received from a doctor about my personal process for doing CEREC same-day veneers. So a few questions. First question was, what material do you like to use? I like to use Emax for almost everything. There are a few indications I'll go to zirconia for. I don't have any qualms about using lucite or feldspar, but I prefer to use Emax. So I'll use Emax for almost everything. Including veneers, crowns, some anterior bridges, etc., etc. So second question, what prep design? Now I have done a lot of standard veneer preps with minimal reduction, or even a few cases with almost no reduction. I don't generally like how those margins turn out. Usually they come out pretty good, but generally speaking, my preparation for veneers have transitioned more from what you'd conventionally think of as a standard minimal to no prep veneer design to more of a modified crown design. Anterior teeth, usually I'm going to leave a large portion of the lingual alone, most of the cingulum intact depending on where the contact is. So generally speaking, from the anterior, my veneer preps are going to look more like crown preps with incisal and facial and buccal, incisal, facial, mesial, and distal reduction, with some lingual reduction, but a very simple margin, nothing real complicated. Let's see. Waxups. So yes, if we have a patient who is interested in seeing what they may look like after the fact, then definitely we'll do a wax up. I like to do wax ups from the lab. I don't generally do those anymore myself. There are some applications, some free apps you can download and plug in smiles over the patient's face, and that works really, really well. There's a smile design feature in CEREC, which you can use when you're designing anterior cases, which I haven't used in a while, but it's a really good case presentation tool to use if you want to use that. But generally speaking, I don't use a whole lot of wax up. Now a couple of things to consider. If you're new to the CEREC veneer process, if this is your first few anterior CEREC cases, you're going to want to be real cautious with how you tackle these cases. Prepare yourself well ahead of time. So if you have a wax up and you're going to do biocopy, which a lot of us do, make sure you have ample time to do that. Again, if it's your first few cases with a CEREC anterior design in your, what am I trying to say? If it's one of your first few cases and you haven't done it before, I would hedge your bets, meaning prepare temporaries or make temporaries and do the design process while the patient is not waiting, getting concerned and frustrated with you, getting frustrated and sweating and yelling at the machine. So do your design after the patient leaves the office, or you can do your design over your lunch break or something like that. Just spend some time really dialing into your design process so you're not stressed. You can come back to it, give it a break, come back to it in an hour or two, spending some appropriate time doing that first design process. As you all know, anterior crown work is much more complicated on the CEREC because of the nuance and the visibility than posterior crown work is. So you want to be real cautious with your design process and make sure you have ample time to do that design work. Let's see what else. Try and paste. So I don't normally use try and paste. I like to use the LT low translucency Emax blocks, and so the paste, the translucence level, the color of the cement that I use doesn't generally modulate it that much. Now it would still be best practice to consider using a try and paste. I like to use Variolink aesthetic, not try and paste but cement, for everything essentially. Let's see. What was the last question? There was another question with regard to veneer preps. I will tell you this, Gordon Christensen, well-known dentist, has said, I was with him in a meeting. He was teaching a course, let me correct that. He was teaching a course, and he talked a little bit about the more crowns that you do, theoretically, not actually, but some people do this, theoretically you should be charging more for each crown because it's essentially a little more heart muscle, a little more stomach lining, the stress and the worry that we have with doing these bigger cases because we've become married to these patients in a way. So the more that we do from the standpoint of restorations, the more potentially we should consider charging the patient, because it becomes, you're more involved, you're more linked to, more married to that patient. Timelines, if you're doing a big case, especially anterior cases, if you want to have the patient wait around, just make sure you always overestimate the time it's going to take, and then over deliver. So then you actually deliver a more pleasant experience when it takes less time. But these, I don't have any issues or worries doing anterior aesthetic cases with CEREC. CEREC is a fantastic product. Just make sure that you know what you're doing. You've heard the old saying, garbage in, garbage out. If the user, us as clinicians, whether it's me or a lab technician or a dental assistant, puts garbage into the machine, you're going to get garbage bonding into the mouth. So make sure that you do your part to get a good quality, high quality design. You do your prep work ahead of time, not only preparation for the case, but preparation on the teeth, so that when you deliver that, you're delivering high quality restorations. But veneers can be a great, fun adventure, can really do some fantastic smile transition makeovers for these patients. It's a wonderful opportunity. Hopefully this has been helpful, and I haven't rambled too much. If I missed anything, go ahead and send me a message. I'd be happy to kind of plug in some additional thoughts and commentary as it comes to mind. Thanks, bye.